Welcome to ENT Shorties, short, easy videos for primary care providers and students. This is the first lesson, and it is for anyone who is new to clinical medicine. It introduces the lost 4 techniques. Seemingly basic, I see these being neglected every day. These skills develop the original AI, actual intelligence, not artificial. The lost 4, ask, look, touch, and think. Many say, I don't have time for these things, but mastering them will get you to the true diagnosis faster. Let's look at each. Asking questions is your most powerful tool. Detailed questions show you're engaged and caring. Patients want you to listen, but they expect that you won't. They often say that providers look at their computers and don't address them as individuals. Ask more questions. Remember, the fastest way to do something is to do it right the first time. Slow down and ask more questions to increase your understanding of your patient and evolve your thinking. Your patients will teach you if you will just listen. Finally, don't trust the information in a pre-visit templated history. Templates generate information quickly, but are rarely complete or accurate. Don't ask, are there any changes to your medication? That's a worthless question if your list is inaccurate. Read it back to them, even when they just provided it. The patient will often say it is wrong. Also, ask about the negatives from the history, but don't trust them either. I remember one patient when I said, it says you don't drink alcohol, and the patient responded, no, just beer. Look, and look carefully. This is probably the most neglected area for ENT problems. First, you must have proper equipment to examine the ear, nose, and throat. Most primary care offices have little or poor ENT equipment. Bright headlights are inexpensive and allow hands-free examination that cell phone lights don't. Most otoscopes have small bore speculums with very limited views. Large specula give amazingly better views. Poor equipment leads to most ENT exams being reported as WNL. This isn't within normal limits. It's, we never looked. Touch. Touch means mastering your physical examination skills before ordering labs or imaging. We now live in a touchless, no-contact society, but this isn't the best way to practice medicine. When you exhaust your questions and your examination, only then order labs or imaging. Get only what you need and know how to interpret it. Understand how these tests influence your plan and keep it focused. The wide variety of tests can lead to you down a rabbit hole with false positives. Think and learn. Use your brain. Don't rely solely on protocols to tell you what to do. Don't get fixated on one idea or diagnosis, especially when the patient or someone else says that's the problem. Patients love to say, I have sinus, or I have fluid in my ears. Occasionally they're correct, but often they're not. Think about the implications of other treatments on unrelated areas. Did the ACE inhibitor used for hypertension cause the dry cough? Is the nasal cannula oxygen worsening the nosebleed problem? Read your consultant's notes. Learn what they did and how they did it. It's free teaching to expand your knowledge outside your area of expertise. For imaging, watch the movie. Don't just read the review. Look directly at CTs and MRI images and compare them to the radiologist's interpretation. Over time, you'll develop skills and you may catch things the radiologist didn't even know to look for. Finally, the most important question, always be asking why. Why did this happen to the patient? What caused this? And how can I prevent it in the future? Use critical thinking. Asking why is often the key to a correct diagnosis, and we'll see this in the first case. When you finally decide on a treatment, ask yourself the following. What problems may arise from this treatment? What is the worst case scenario with this treatment? What if I'm wrong about my diagnosis? What else could it be? What happens if the patient doesn't follow up? And lastly, what would I want to know about this treatment if I were the patient? Here are the key points to approaching patients. When you start looking for and thinking about them, you will see many opportunities in your practice. Let me hear your experience in the comments section. If you find these videos helpful, please like, comment, and share to keep them coming. After a case study, we will dive into nasal allergy care. The next video will be a case from my clinic. It clearly demonstrates most of the principles outlined. I'm interested to know if you have stories like these where the principles outlined led you to a better diagnosis and improved care.